Hey, I'm Dr. Perry from Farmington Family Dental. Thanks for joining us for these videos. We're going to be talking about implants and how they function in the mouth and answering some of the more common questions that I see when patients come in and ask me them about implants. So what are dental implants? Dental implants are a piece of metal, or titanium is what they're made out of, that we put into the jaw, upper or lower, to support something that sits on top of it. Whether it's a denture that's on top of it, or a crown, or a bridge, all are possibilities for what we put on top of it. At the end of the day, the marking thing that shows that, hey, this is an implant is it's engaged into the bone. It's locked into the bone and it's not coming in and out. It's not moving at all. It provides a solid platform for whatever we put on top of it. Typically, dental implants are recommended when you're missing teeth. For those of you out there that are missing a number of teeth, you've probably noticed when you chew on things, you'll get things stuck or stabbed down into the gums when you're chewing, like Dorito chips is probably a really good example of that. Or if it goes on long enough, if you're missing enough teeth, it's just not enough teeth remaining for you to be able to chew what you want to chew. You'll go out to the restaurant and you'll open up the menu and you'll say, well, okay, I want to eat this, but I'm not sure if I can. Or you plain old don't go out to eat anymore because it's too embarrassing to be able to be in that situation and not able to chew. Those are the spectrum of situations where we as dentists recommend putting an implant in to restore back what once was there. Dental implants have a lot of advantages. One of the main ones is they don't require that we touch the teeth on either side. So one of the main alternatives to a dental implant in a lot of cases is putting in what's called a bridge. The downsides of a bridge is we have to touch the two teeth side by side, and if they're perfectly good teeth, why are we doing that when there's an alternative option? Implants are a great alternative option that allows you to have the restoration placed on just one tooth without grinding away on the teeth next door if it's not needed. Oh, great question. So the process you'd go through if you decided to do dental implants, the first step would be come on into the office. Come, I will do a free consult with you. We'll take an x-ray, we'll see what your needs are, whether you qualify for an implant procedure, how that would go down. I will talk about timeline, how long it takes to do it, what all is involved as far as healing, any discomfort that may be involved. I will talk about that. And I'll talk about the price, what all overall is the big picture of doing these. You'll leave knowing this is what's possible and knowing ideally what you would like to do. The dental exam for implants is very similar to a typical exam. We're going to take a big picture view x-ray that shows us where bone is, where teeth are, what kind of situation things are in. And we're going to do a look inside your mouth to see what is the situation of the existing teeth, if there are any, how many, and how are they doing. At the end of that, we'll have a very good, or in a lot of cases, a definitive view of what needs to be done. Sometimes we ask medical history and people ask, why are we doing all of this medical history? Why are we asking about medications you're on? Why are we asking about any surgeries or cancer or other things like that? We're asking because at the end of the day, placing an implant requires two things to be successful. One of them is a good, successful surgeon and surgery. I can take care of that part on my own. The second part is the healing that happens inside your mouth. If there's anything that's compromising or interfering with that healing, sometimes that requires modifying a plan, going about it a different way or slower, allowing more time to heal. Other times it requires taking control of the systemic, the body issues that are there so that they're not a problem. Examples of that are diabetes that's out of control, blood pressure that's out of control, any autoimmune disorders they need to be modified for, and other such things. And I can go into the specifics when you come in. Every person is treated individually when it comes to any dental treatment, but more especially surgeries like putting an implant in. Well, treatment plans that are right for you, we develop those in a dialogue or in a conversation. That is what I found to be the best way. Because I see some things, but I don't see everything. I don't see everything of what you want, what your desires are, until you start telling me. So you'll find when you come in for that appointment and do that consult with me, it is a consultation in that it's two ways. You're going to hear me talking to you and asking questions and hearing those answers back, and I will modify my plan depending on what you tell me you want. When there's something that's close, well, you could go either way. I'm going to tell you about both because I want you to be informed either way. The steps of placing an implant. The first step is the diagnosis, finding out what all needs to be done. We need to create a plan. We need to talk about timeline, expenses, finances, all of that, make sure that's all squared away. After that, the first step is typically placing the implant or preparing the site. Sometimes that goes through anywhere from 1 to 3 or sometimes even 4 steps of different things that need to be done along the way, where we're getting you numb or we're harvesting a graft or putting tissue where it needs to be to give you the best end result with your implant. Bone grafting is required when there's not sufficient bone or the shape of the bone that's existing there would cause a compromise to the longevity or lifespan of an implant. I see that typically when we're taking a tooth out and we're immediately putting an implant in. Bone graft is almost always a necessity there. If we are putting an implant in a site where it's been a while since a tooth has been in there, bone grafting is typically needed for something like that. But the steps that we go through, we consider first where the soft tissue is, because oftentimes that needs augmentation or changing of its shape to give you the best aesthetic result or the best longevity possible. And then second is the bone grafting in the stage of things. And bone grafting is typically required when there isn't enough bone to support the implant, so from a functional perspective, or the bone isn't supporting the soft tissue around it. It's an aesthetic or a long-term longevity issue that we use bone grafting for. When we choose our artificial teeth, I rely on the lab for that a lot, to the extent that I have them look at the existing teeth and seeing, okay, what kind of tooth do we have? Are we roughly triangular shape? Are we square shaped? Is this a very masculine looking tooth? And we want to match as closely to that as we can. In fact, most of the programs that are used in the dental labs nowadays use some component of AI to detect those properties and kind of copy and paste more or less onto the existing tooth. If aesthetics is a high concern, like 10 out of 10, it's very, very important to you, bring that up in the consultation. I will talk with you about it, and I will typically ask if I think aesthetics are involved with what we're doing. Bring it up, though, and we'll talk about how it can be done to make the best overall look possible for your tooth. So sometimes people want to know, well, what's the pros and cons of taking something out versus just fixing up what's there? It really depends on the individual tooth, your end desires, what kind of longevity you expect, and a number of other factors like that. That is a conversation with you of what I would recommend. Typically, when I talk to people, I'm going to recommend what I would do as the first thing we talk about. And I'm going to compare some alternatives. If they're close, if they're good alternatives, I'll compare them to what I would do so that you can get a feel for what is reasonable or what might fit best on your desires for the treatment that's rendered. At the end of the day, this isn't a one-sided thing. It's not me telling you what you must do. It's you telling me what you want to accomplish and me advising, well, this is, I think, the best way to accomplish what you're looking for. Or if there's compromises to what you're looking for, or it's not attainable or realistic to do it, I will tell you that right up front and say, okay, this is what I think we can do, but it's different from what you told me right here in this one area. Like maybe we want to fix something up at any cost. Okay, let's fix it up, but I see a functional compromise in doing this. We're probably not going to get the longest lifespan, but it's still worthwhile. As long as it's still worthwhile, great, let's do it. Let's get you taken care of the way you want to be taken care of. Ooh, the recovery for dental implants usually isn't too bad. Typically, when we take out a tooth and put an implant in that day, the recovery is a couple of days, probably about 3 days or so with some soreness. Ibuprofen and Tylenol are go-tos for that. Sometimes we'll use some stronger things if there's other things going on. But typically, putting the implant in really doesn't hurt much, either immediately after or in the long run on things, unless there's a graft issue or there's a failure of some type in and around the implant. So usually the recovery is fairly similar to a tooth coming out. If we're not also taking the tooth out that day, the recovery is great. I rarely see any soreness with that, and the success rate is higher when we're not taking the tooth out that day and placing the implant that day as well. Oh, dental implants as we know them have been around now for about 30 years. The type of implant that we use nowadays more than any other type is what's called an endosteel implant. That means the implant is placed with bone all the way around it. The longevity of this type of implant, because it's only been around, I know they say only 30 years, but that's relatively new as far as the dental profession goes. We have seen routinely around 15 years. There are two caveats to that. If there's a compromise to the situation, we don't do some soft tissue grafting where we needed it, or you have uncontrolled diabetes or smoking are probably the two systemic issues that influence that the most. You can see a decrease in the longevity by up to about half in a lot of cases. So you can get about half that lifespan if those things are going on. Dental implants do not get cavities. It's not possible. There's nothing in and around them that can decay. The problems that dental implants have are periodontal in nature. So if you've ever heard about somebody getting like long in the tooth, or they needed a deep cleaning, or they had advanced gingivitis, are different colloquial terms I'll hear for it, those affect the bone around the implant, which in turn will affect the implant. But you will not see decay around a dental implant. So cost on this, let's get into the weeds on insurance, what they do or do not do. This gets into the weeds a little bit. Dental insurances have found that if they exclude certain procedures from their coverages, that they'll pay less and they can charge less in premium. And for them, it ends up being a game of how little can we charge our subscriber while still delivering what they think is dental insurance. Typically what I see, most dental insurances don't participate in a significant manner with the actual procedure codes that are involved with placing an implant and placing bone graft. Typically I see them involved with extracting the tooth, and sometimes even putting the crown on top of the implant or putting the denture on top of the implant, whatever we decide as a final restoration we're putting on top of it. But that really depends on the insurance type that you have. I would say most do not, but in questions on this, it really deserves looking at the insurance individually and seeing what your policy prescribes. Okay, so costs, financing options, how do you pay for what is involved with an implant? The average dental implant that I see sits anywhere from about $4,500 to about $8,500, depending on whether a tooth is coming out at the same time, whether we need soft tissue grafting, whether we need bone grafting, what all is required to develop the site into an ideal situation to keep that implant in there long term. All of those things there are really individual. Now, when I'm talking about money like $4,500 to $8,500, obviously that's no small amount of money. Typically what I see people do is either they'll pay cash, card, check, and sometimes finance. Now, financing to some extent does require a credit score. If your credit score is above about 600 or so is where I tend to start seeing success as far as financing goes for that. All of that said, financing tends to be one of the more popular options that I see for paying for a treatment like this. Okay, so how can you get a hold of us? Give us a call. When you talk to the gals, they'll get you scheduled for your consult appointment. Our phone number is 573-756-5760. I'm excited to see you. I'm excited to see what you need and what we can do to help you along your way. I hope we've been able to answer some of your questions about dental implants today. If you have any others, or you want to talk specifically about what's going on in your mouth, give us a call, 573-756-5760.